Good day. Welcome to APA's weekly webinar. My name is Billy Zadig, Manager, Special Projects for APA. Just a couple of housekeeping items before we get started. The webinar recording will be posted to the APA webpage later this afternoon. You'll receive a follow-up email in the next couple of days with a link to the webpage where all webinar recordings are housed, as well as a link to our upcoming webinars. We have webinars planned out through the end of 2021, and many are open for registration. Professional continuing education and AIA CLU credits are being offered for today's program. If you are an AIA professional requiring a certificate, please send an email to me at Billie, B-I-L-L-I-E, @apa.org, along with your AIA membership number if you've not done so in the past. All attendees are in listen-only mode. Please type your questions to the chat box and they will be answered in the order they are received. If we run out of time and we still have questions, responses will be sent directly to the person asking the question by our presenter. At this time, it's my pleasure to turn this over to Monica Keel of Phygenics. Monica, take it away.
Thank you, Billy. My name is Monica Kyle. I'm the Marketing Director at Phygenics, and I'm joined by Molly Scanlon, who's the Director of Standards, Compliance, and Research at Phygenics, and she will provide a little more information on her background as we get started. Thank you all for joining us today, and I'm going to start with our bias disclosure. We think it's really important that we provide our bias disclosure as we do these webinars. So Phygenics provides independent expert guidance for the development and implementation of water management programs to prevent building-associated injury and disease and to improve operational efficiency for facilities. We provide real-time monitoring solutions, cloud-based data management, and environmental testing for all waterborne pathogens, and analytical services for water chemistry. Phygenics does not sell water treatment chemicals or disinfection products, nor do we have commercial affiliation or funding from suppliers or manufacturers of such products. And as we get started, I'm also going to cover our learning objectives for today. So this is a webinar that's going to cover water management for construction. And so as Molly goes through her presentation, we are going to identify the challenges and risk factors for the growth and spread of waterborne pathogens in buildings based on the design, construction, and lack of commissioning activities. She will also demonstrate how to create water management for construction programs responding to design, construction, and commissioning activities. We'll also cover recognizing the challenges surfacing from lack of conducting water quality commissioning activities and damage to building assets within potable water distribution systems. And finally, we will discuss appropriate involvement of engineering and construction professionals and other consultants on water management teams in conjunction with the building owner's water management teams. So this is a great list of learning objectives. In addition to that, I'd like to cover 3 acronyms that Molly will be using as she goes through her presentation, just so that everybody has the same understanding of what these acronyms are. So the first one is WMP, and when we say WMP, we are referring to a water management program. When we use the acronym WMC, we're referring to water management for construction. So you can also think about that as a water management program for construction. And the final one is SRA, which stands for Safety Risk Assessment. So again, Molly's going to be using these acronyms through her presentation today. And so hopefully everyone has an understanding of what those mean. With that, it is my pleasure to turn it over to Molly Scanlon, and I will join you back for the Q&A at the end.
Thank you, Monica. Thank you, APPA, for having me today. Dr. Molly Scanlon here. I'm an environmental and occupational health scientist, so that is a public health degree. I have mine in my doctorate level from the University of Arizona. I also have a second prior profession and still have my licenses, and I'm certified as a healthcare architect, but I'm working at Phygenics as the Director of Standards, Compliance, and Research. And in my traditional role as an architect, I used to protect building occupants from air and waterborne pathogens back in the day, and then got my doctorate and came to Phygenics after I met our chief technology officer, Dr. William McCoy, who worked with me with the Centers for Disease Control on a training grant at the University of Arizona I'll talk about briefly, that's called Prevent LD for Legionnaire's disease. So I want to start out with three things I call Mythbusters for water management for construction. So for the WMC, these may be true also for a WMP. So go through these one at a time. So if you're from the design and construction industry, there's a lot more talk in those industries about water efficiency and conservation of water, and that's important. Understand that. But there's a misunderstanding that that equals sustainable water systems. That is false. You must have water safety plus water efficiency to have a sustainable source. Who wants the water if it's unsafe? No one. So if you do not practice water safety in combination with water efficiency, you don't have a sustainable water supply. So we need to be looking at both parts of this equation. And I find that design professionals, because of building rating systems and building codes, have been indoctrinated heavily in the water efficiency and minimally in the water safety. So just keep that in mind. Mythbuster number 2 is that plumbing specifications cover water safety. They generally don't. So they cover what's called water quality, which might be the drinkability of the water, but that doesn't mean the water can be used for other things of hand hygiene, showering, etc. And so specifications that involve E. coli or coliform testing are for fecal matter. That is not the same testing as doing for water safety for Legionella and other waterborne pathogens. And primarily plumbing specifications check on performance of the water system, meaning that the water comes out of the pipe and it's heated. A lot of times the water quality and safety are not checked and are not a robust part of the construction process. So typically the contractor's general conditions, their specification or commissioning practices lack water management criteria and the proper verification and validation and methods that you need to assure water safety. So Mythbuster number 3 that we're going to try to work on today, along with those other two, is that water management isn't only for ongoing operations. Construction activities are associated with contributing to disease cases and deaths from building water systems, both in potable and non-potable systems, cooling towers, etc. And so we'll discuss a little bit of that today as we go through. So I'm not going to go through what Legionella is and all the pathogens and background per se. But the underwriting documents that we're going to be talking about is primarily ASHRAE 188. It was originally published in 2015. Its current publication is 2018. This document must be purchased by ASHRAE. I believe it's around $80. You can get it from their website. We'll be referring to sections from that. The second document on your screen is the CDC's toolkit, developing water management programs. I call this the water management primer for beginners. It's easily read, meant for public distribution. It's free on their website, as well as a lot of other supporting toolkits that go with that this program. And then I'll sometimes be referring to the AWWA standard for disinfection of water mains 651 and 652. If you feel you need training in water management, I'm going to go over the fundamentals today, but not in any detail. There's a wonderful 3-hour training program free on the CDC's website called Prevent LD. I mentioned before, I'm one of the content developers at the University of Arizona. The link will be here on the slide for you. It's a modular process you can go through on your own time. You connect over to a link at the University of Arizona. There's case studies, there's forms, and various things to give you a really in-depth primer that complements the toolkit in training if you're really not familiar with water management in its full context. So to give you a brief summary of water management, so if you look at ASHRAE 188, 2018, there is a graph chart that talks about the steps of water management. I'm going to briefly go over these. There are 7 of them. This is Phygenics' pictogram interpretation of those. And so I'm just going to briefly go over what those requirements are. So you're supposed to do a risk management process. You formulate a team. It's to be interdisciplinary. You should have a goal. What buildings are you covering? Why are you covering them? Who are the occupants of these buildings? What is the extent of the program? Those types of things, more of an executive summary of what your SMART goals are. You need to describe the system. A process flow diagram has to be created, which is usually a 1 or 2 page document. There's examples in the toolkit. And you have to do what's called water use descriptions. You have to then eventually analyze the hazards of the water system. So hazard analysis and identification occurs at step number 4. Phygenics, we suggest that you do a safety and efficiency analysis so that those things can work in conjunction with each other for that sustainability of water I talked about. And you will analyze physical, chemical, or microbial hazards at that step. Once the team identifies what hazards are in the building, you will do what's called hazard control in step 5. You'll specify the controls. Controls can be flushing, chlorination. There's a whole variety of things that can be done to make the water system safe and manage it. And you'll discuss what the controls are, determine them as a team. And you'll have locations for those controls, you'll have limits for them, methods of monitoring, and corrective actions that you will need to take should the system be out of balance. You'll also need to have a verification strategy. So in this context, verification is confirmation that the program that you've designed is being implemented as designed. So I often tell construction professionals, all you're doing is think of this as your specifications. These are your documents and specifications, and in verification, you're supposed to follow what you did, and you're supposed to document that you did it. That's what step 6 is for verification. For design professionals, validation is it's a different step, and that is confirmation that the program, when it as designed, is effective, that these controls are effective in controlling the hazardous conditions throughout the building water system. And usually you have to do some form of testing. In public health, they do clinical surveillance. That's very common in a healthcare setting. But very often you test the water to see if the program is actually working as it was designed, and you may have to change the program. This program is to be documented for defensibility for the building owner. So in terms of construction, there's lots of aspects to 188, but we're going to focus in today on construction activities. And so the building owner is required under section 4.2, they must survey the existing building. This is sort of how you opt into the standard. But a lot of people don't read the rest of that paragraph. And so this is what people do for their ongoing operations. However, you need to also do this if you have a new building emerging, renovations, additions, or modifications to the existing building and its water system, because any of those activities could upset the balance of that water system. And then people fail to read the furthering paragraphs where it says that once you've done those survey, in order to confirm and with compliance the requirements of the standard in section 4, you're supposed to do this prior to the occupancy of a new building and before construction even begins on renovations, additions, or modifications to the existing building. So these extra highlighted areas I find people haven't read in more detail, or their other professionals haven't made them aware of this. If we dig further into 188, in the latter section, section 8, the last section, there's a section on designing building water systems for our design professionals. It has a list of things that you should do. I think most of those I won't go through those today, are readily what design professionals frankly are doing, except it does request that you're supposed to be providing a commissioning plan for the building owner. And I find most people don't know how to do that or even know what it is, because they default to the plumbing system being commissioned, meaning it doesn't leak and the water heats, but they're not doing anything about the water quality and protection in that. So that's the difference. We're talking about water quality and safety commissioning, not the piping itself or the system itself, even though those things are highly interlinked. It will discuss that you need to use the disinfection standards from AWWA 651 and 652. But there's a paragraph there that starts to discuss disinfection and flushing, and it mentions that 3 weeks prior, within 3 weeks prior to the whole or beneficial occupancy, some of you may use the word substantial completion for this term, you need to be disinfecting and flushing the building and prepare it so that it's safe. And if there's going to be a delay in that occupancy, which they're often the first business day of operations is not the same as receiving it from the contractor, depending on the scale of the project. So if building occupancy is not going to occur for 2 to 4 weeks, you're supposed to be flushing all fixtures in order to maintain the system after it's been disinfected. And then if it's delayed more than 4 weeks, that water management team that's been formulated is supposed to have a plan of how they're going to maintain that program and building. And I find that this sort of falls apart without coaching or understanding or having a water management plan during construction and commissioning in place. So how do you fill those gaps? That's what people ask all the time. So what I'm helping to train people with is really 2 things that you're going to need to do in the future. One, your construction policies will probably need to be audited. And I use the word audit loosely in that they probably don't contain water management information, but they do have a format to them. Your organization, depending on scale, maybe has a master specification. Maybe you have contractors' general conditions for your organization, commissioning practices. Maybe you have internal permits for starting or shutting down utilities. These forms and policies may need to be audited to properly include water safety and water quality initiatives. And the second part of that is there is something, I'm not going to go into a lot of detail today, but I want to touch on is you may be able for maintenance projects and very small projects where you're replacing something in kind, you may want to do a safety risk assessment for small projects for before, during, and post-construction activities. And I'll go through a little bit of that later. The other aspect is you would actually write a project-specific water management plan for construction or commissioning. This could be for the potable or utility or non-potable systems, and it would include flushing and disinfection protocols. And this would be either, we have some clients that have hired us for this advice actually during the construction activities, which I'll show you a schedule. Some come on later where they're closer to this beneficial occupancy, and they do this up to their first business day, in this case student or faculty day, or when you're going to open the building to the broad public as opposed to just the maintenance facility and initial move-in types of things. Even though the standard starts at 3 weeks prior, we have been finding that it takes a full month to 3 months to commission this water system prior to opening to the public to get everything calibrated and working in the manner in which it's going to be safe. So this is a study I'm going to take you through. So how and what exactly about construction? So when I first started in water management, people would tell me about construction activities or different things. I said, wow, that's a broad topic. To the general public, construction might be construction, but to construction professionals, they want to know, what exactly are you talking about? So this study is available to you free online. You can use this citation. It'll be on the slide. If you want to search my last name, Scanlon, and water management for construction with evidence for risk characterization, it'll pop right up online on the Google search. And you can go to the journal's website and they have a PDF of the entire article. I'm going to give you a summary of that here. So a couple years ago, some colleagues, I was a principal investigator, we decided to do a search of literature, scientific literature, to find out what exactly in construction is causing this problem and how big the problem is. So we looked at building settings, healthcare and community settings. We looked at construction types, and we looked at pathogens of interest. And we did a formal systematic review, the gold standard, for doing literature reviews. And we found 31 studies in the scientific literature with events from 1965 to 2016 that showed disease cases and deaths associated with construction. And the main pathogen of interest published in that time is Legionella or non-tuberculosis mycobacterium. And there's also Sphingomonas and Fusarium. We did the search on a wider level of pathogens. And we found that construction had, in just those 31 studies, had created 894 disease cases in buildings and 112 deaths. A lot of them were associated with healthcare, but there were in other building settings as well. We found 9 activity construction risk factors that we're going to go through one at a time today. Our overall findings were that this construction really should be incorporated into the overall water management program. We need to have more robust commissioning practices. There's something wrong at the startup of these buildings. We need to raise our public agency awareness so that we can lower the number of these disease cases and deaths associated with this. And we need to have proper dissemination of this information to our colleagues here in the design and construction, the AEC industry, and our building owners about education and training, which is something we're doing today. And we want to improve our construction policies. That audit needs to be evidence-based, and so we need to be looking at how we can improve these safety plans. This is a summary slide of the 9 construction risk factors. As you're taking notes, I'm going to go through these one at a time on an individual slide. So just quickly: commissioning, excavation, repressurization, demolition, construction equipment, water main breaks, vibration, efficiency design, and underground utility connections. And we'll start back at commissioning. So these are the known factors. So at commissioning, at that building startup, we found that there was an improper process of disinfecting and flushing protocols, and there was no monitoring. Nobody seemed to know what was going on, yet the building would open, disease cases would start to emerge or be assigned to the building, and people wouldn't know where it was coming from. It would be a chaotic experience and a lot of liability in situations like that. So if there was a uniform process of water quality, this would cut down on that. And so we need people that are going to have this process in place and check that the functioning and the water quality is verified and validated through that specification and process. The second risk factor is excavation. So a lot of folks don't know that soil and sediment actually contains pathogens of interest. They may be in the dry format. They can become airborne or can contact a water reservoir or moisture source. So a lot of folks in construction just say, it's discolored water, we'll just flush it through the system. But all that particulate matter and that's organic material can get caught up in a system in very fine particulate matter, and it can add to the growth and spread of a pathogen. And so we want to reduce that. And it's not appropriate to just wait until it clears and assume that that water is safe. It would be safer, but it doesn't mean that if it was left in the system in a dormant state and you didn't know that that was in there, that would not cause a problem. And excavation is connected to several of these other risk factors. Anytime you repressurize the building, especially under existing conditions, in startups and shutdowns, you can loosen biofilm, sediment, this nutrient substance, and you can launch it downstream to an unsuspecting department or, immunocompromised population possibly, and then they become exposed. This has been associated with disease cases and deaths. Demolition. Some people may think of demolition of the piping itself, but this is actually demolition of paving materials, buildings, piping distribution systems, utility tunnels. You can create air plumes of dust that include the pathogen of interest or can be overburdening a cooling tower. So these can create plumes of large dust that go up. They drift into air intakes that come in contact with a water source and then begin to grow and spread the pathogen that way. Or the air plume can rest into a cooling tower and then it gains moisture from there and then starts to become part of the drift and becomes a community outbreak and spread. And so again, that soil and sediment is from an airborne source. So you have to think of your demolition projects on a much bigger scale. Efficiency design. So as much as our AEC professionals may be designing to the building code or these rating systems, nothing wrong with that. But how are you making sure that these systems come online properly How do they have proper flow? Is it appropriate for the building type, the user type? How is this impacting water heating, water loops, and terminal fixtures? I find that people just simply assign these to the project without having a more robust discussion about how that's going to impact the building occupant and water safety. So you don't want to install all these things, have them not work, and then have a disease case or an outbreak and have them all removed. Underground utility connections. How do we actually, so obviously there's a lot of talk about infrastructure. The new federal package that might be approved for infrastructure includes the replacement of lead line service lines, but there's a lot of folks that as our aging infrastructure is happening, they're changing out their underground utility connections, or your municipal water supplier out on the street could be making a utility connection change. How is that impacting what's happening? When they make those changes, your water system could experience changes either on your own property or adjacent to the property. Are there any baseline readings of your incoming water system? Do you have baseline readings so then you can do a post-construction evaluation? How would you deal with that with a water utility connection? Construction equipment. Some contractors are unknowingly, they bring water onto the site. They sometimes can bring it from industrial areas. It's supposed to be potable water. Is that in the specifications? Is that water being checked for its dormancy? There have actually been construction projects where water tankers, construction equipment that has water reservoirs, paving equipment, hose sprayers, misters are used. So a couple years ago, I think it was 3 years ago in Indiana, contractor was doing high pressure washing, and they were spraying off soil and sediment, became airborne, and where were they? They were immediately adjacent to a skilled nursing facility. Disease case, outbreak, Legionella, unnecessary. So you have to guard against what you're doing and the populations that you're around and that you're constructing around. Typically, most people think of the water main break as the most common construction risk factor, but actually in our study we found it was the least. It was mentioned, but it wasn't mentioned the most often as the problem. This is usually associated with some other larger project that's happening, the underground connections. People think of the backhoe. Somebody goes out with a backhoe, they strike the ground and boom, they hit the water line and all types of things happen. If that's going to happen, you could have soil and sediment invasion. You want to shut your system down. I find people keep drawing the discolored water through their building. I'm like, what do you want to do that for? You want to stop and have an emergency procedure for how you can move to a bottled water, either boil water advisory with your local authority or a bottled water advisory temporarily while you can get this fixed. But you don't want to pull all that soil and sediment into your system. And the last risk factor is vibration. So another one that people haven't thought about, disease cases and deaths have been associated with either external vibration for large buildings, so foundation pile driving, jackhammering, removing underground utility tunnels or structural systems they've been working on, and you can literally feel the vibration in neighboring buildings, either on your campus or your neighbors' buildings, can create such vibration that it loosens biofilms and again goes down to an unsuspecting population, and there ends up being disease cases, an outbreak. This can also be on a finer level inside the building where people are doing jackhammering, pounding, cutting, saw hacking, etc., on piping they don't realize has biofilms in it, and they haven't isolated that area from where they're working, so that when they start back up, the surrounding folks in the renovation area or adjacent areas know about that. So if we think back to that pictogram, you may say, well, then what's the process? So if you want to analyze those factors inside of a process, the good news is it's the same 7-step process that we have. So the same pictogram applies, same 7 steps using ASHRAE 188. It's just that the process has a little bit different what you're going to do in each step. And I'm just going to give an overview today. So in step 1, forming the team, you're probably going to have some different team members. You're probably going to have the contractor, maybe some subs, the plumbing sub. Maybe you're going to have a project manager, facility construction manager, owner's representative. Maybe you want to invite the safety risk department at the academic institution to be a part of this process to protect, do their evaluation of the populations that are exposed. You may need to do a pre-construction risk assessment. This safety risk assessment I'll talk about shortly for small projects. You may need to integrate that into your policies before you start the project. You're going to need to develop some program goals. What type of project do you have on hand? Are you doing a demolition, new construction, renovation, etc.? When's your opening date? When are you going to activate the water, etc.? So set up your program goals. This would be your schedule of events. Water, describe the water system. You'll need a process flow diagram, just like the other type of water management program. And if you're going to continue the program after opening, you'll want to have your water use description set up for that. Then you're going to analyze your hazards, which includes the risk characterizations I just went over, but how are those going to impact the chemical, microbial, and physical hazards? You may have a more dangerous situation. I often find that the building main needs to be reevaluated in this process as a hazard, where in ongoing operations it might not be considered as much of a hazard. Then you're going to apply control. Big difference in this phase is just your controls are going to be more robust because you're going to be doing something called simulating occupancy. I'll define that in a second. You're going to be simulating occupancy, and these controls will be more robust than your ongoing program in order to do that. You're going to verify the program that you're doing it as it was designed, and you're going to validate it through a testing process. You can't use a clinical or population disease case. There's nobody in the building. So you're probably going to need to do some form of testing of the water in that case and the safety risk assessment. So I talk with building owners a lot about two different processes. I'm going to spend more on the larger building projects today, but I'll go over briefly a small project. So if you have projects that are greater than 30 days duration, and that's defined after COVID-19 and also by the standard, the 21 days prior, dormancy of systems seems to be being defined by scientific literature and by these standards to be in the 30-day range. So if you have a project that's greater than 30 days, you probably need to have a formal process that is unique to that project. If you have a project that's less than 30 days, it's more maintenance oriented or very small construction projects, you could use something called a safety risk assessment. And these things are actually the same thing. It's just one is an individual unique project, and these are more routine and probably prescriptive projects that you're doing all the time. So let's just briefly talk about the 30-day situation, less than 30 days. This is a process that's used in healthcare, and I'm writing a paper to translate this from healthcare environments over to other building types like we're talking to today in education. This has been used for 20 years for airborne pathogens, and I'm writing a process that's for waterborne pathogens that'll be published hopefully this fall. So first of all, you define your project, small, type A, maintenance usually, small, medium, or large type projects. So there's a scale of the size of project. You define your risk groups. In healthcare, they define them into 4 risk groups. In education, we've had folks define them into 2 risk groups, low risk and high risk, and the building types around the campus. So for instance, a high risk for a dormitory, overnight stay, or where there's showering, athletic facilities or something, those might be, or if you had a student infirmary or something, those might be higher risk spaces than, for instance, offices or classrooms where you may have very little water or may not have that much water in certain areas, and you're going to do a renovation. You want to characterize your risk group, and then you kind of use this as a chart. Once you know the size of your project and you know your risk group, you have something called a class of precautions, 1, 2, 3, and 4. And this is a pre-prescribed hazard analysis and control. So in a small project, you might say, well, we're going to have a standard flushing protocol before, during, and after the project. And so we have a baseline reading, and then for our residual oxidant and temperature, we're going to do something during construction, and then post, we're going to take our readings, and as long as we put the system back the way we found it or in better condition, hey, we haven't, the water system should not have changed. But you can decide that based on the risk assessment. So that's the less than 30-day maintenance project. The bigger projects involve a construction schedule. So this is my cartoon simplified version of a complex construction project. for our presentation today. So we water activation in a larger building project schedule. So let's start at the bottom. So we have a construction process and then we have ongoing operations. The split between the two is beneficial occupancy. So this is defined as to when the contractor is releasing the building at substantial completion, the building is safe from a fire and life safety standpoint, and the building systems work, and they're handing it over to the building owner. But typically, it's not the first day of business operations. So that package for construction, if it's a bigger building, may have a civil package, has a building package, which some of you might call shell and core package, and then it has a tenant improvement package. You're actually building out the walls, you're putting in the flooring, the plumbing, the piping, etc. Under the shell and core, you might be doing the risers. Under the civil package, you're doing your underground water system. So at some point that civil package is complete, it gets flushed and tested for the coliforms and E. coli, and then it's parked and it sits. And it's not reactivated again until a later time when the tenant improvement package is complete. And we often find that this system just sits dormant. Someone activates it and brings all that dormant water that's been sitting out there for months or a year, and they bring it into their building water system. Terrible idea. You want to flush that first and get rid of that dormancy and get active water at the head, at the point of entry, then make the connection. So if you then, as you go through this process, when is water activation? When are they pressurizing the fixtures and installing? Typically in the construction process, there's been no timing to this. This just occurs when it's convenient to the methods of construction, which is fine. However, that water will be activated and then very little water is drawn off of that. The contractor might use it for a construction bathroom. They might use it to draw off water for making mud or other installation methods, and all this water in the system acts like a giant dead end of dead water, I call it, sitting in your system for months or a year. And then that's what you're going to pull through your entire system. You don't want to do that. So you want to have a program where you activate the water and you know that you've got fresh, chlorinated or residual oxidant fresh in water, and that your temperature of your waters is good, either in the cold water system or the hot water system that's activated. So what we've been working with clients on is how to write a program to do simulating occupancy through flushing, either manual or automated systems that will flush and raise the quality of the water so that when you're ready at that disinfection point 3 weeks before beneficial occupancy, you're already into a positive water situation. And you have a program in which you're activating that water so that when you arrive and hand it off to the building owner knows that water is safe. So this is what the water management during construction program is, and we help people write that from the beginning of the project all the way up to their beneficial occupancy and their first day of business operations. Then when you hand that over to the building owner, you don't have to, this water management program that's been written is ready now for operations. You have to sunset your controls and refine them for what they will be once people are in the building and they're using the fixtures. You don't need to use the same level of those robust controls I talked about. And then if you're a building owner that has a water management program, you don't want to receive a building that's out of balance like that. You want to go into your ongoing operations with a positive impact for your building occupants. So I've been doing this for the last 36 months in pilot phases. This is very new in the United States to be doing, so there's not a long trajectory of this, but these are the learning lessons that our team here has been finding. First, the project schedule that you're going to put together for water commissioning is critical. Many of those activities are already in the spec. They're just not organized in a timely sequence. So if your team can do that, you'll be way ahead of the game. You probably lack routine and adequate flushing protocols. We've been finding very high bacteria in almost 100% of these buildings. 90% of all the buildings we're commissioning have very high bacteria without the proper sequence of events. And then sometimes we are finding waterborne pathogens. I'm still working on a paper as to what the percentage of that is in the buildings that we have done. Temperatures are often not set, or if they're set at the water heater, no one finds out that it's actually distributing properly. Mixing valves and pumps are working. So we end up finding a lot of defective equipment in this process. I'll tell you that 10 to 15% of the equipment in these buildings is defective in these plumbing systems and is not working, even from a performance level. So then you have a water system that's not capable of defending itself from a temperature situation. We've also found substitutions of products that contractors have done without the building owner knowing it, and it compromises their ability to manage the water system post-occupancy. There's been a lack of residual disinfectant in these systems. Sometimes there's been no pre-planning, either before, during, or right up to occupancy, and that becomes a problem. Premature installation of equipment that has water reservoirs. The simple example is an ice machine. These things will arrive for nutrition and dietary areas. All this equipment is installed. Nobody uses it. They just do it in the sequence of construction. And then it should be going through preventative maintenance, but who wants to be drinking this water after it's been sitting or making ice and then sat there for months? So all these systems have to be dumped. They have to be cleaned, and your warranty is then going on. You may want to work on the sequence of how these get installed. You may have soil and sediment from either on or off-site construction adjacent to what you're doing that could damage your system. We've seen that happen and been called into a situation where you had to stop bringing water into the system until these things could be corrected because it was scarring the inside of their piping and destroying water heaters. There's a lack of standards and awareness. So from the AEC industry, architectural engineering, construction, all of these in facilities and construction teams, there is very specific water management terminology. Phygenics doesn't make it up. It's been part of the ASHRAE standard. And so you may find that you have to really use that language. So when we're using verification or validation or those steps that I showed you, it is going to become your responsibility to know it. You may need to take a training program to have that base language so that you can participate effectively on a team. And then the last but not least is that an amazing number of building owners build a building that they do not occupy immediately, or they don't occupy it fully for quite some period of time. If that building is going to have large occupancy to it, you need to be aware of that so that you can have an effective program coming out of commissioning to deal with the dormant parts of the building. Maybe some areas should be drained and not have their piping be activated, et cetera. So in our last few slides, I want to talk a little bit about the impacts to budgets, because people say, where do I get the money for this? It needs to be included. I'm not going to go over what the budget dollars are, because that's very dependent on the size and scale of your project. But I want you to be aware of what could happen. So there is 3 types of aspects. You may experience that you need to have changes to this primary package. So you might have some fees that are associated with having to change general conditions and specifications to include sections on water management during construction that will deal with water activation. You are going to probably have a contractor eventually, most have been very cooperative in participating, frankly, but some are starting to ask, well, what about the labor and all the time I have to put into this? How do they participate on the team? What is their legal obligation in this contract to do that? What is their obligation to perform these controls, flushing or otherwise? You want to include that in your specifications. They may need to purchase minor equipment like a colorimeter for residual oxidant readings. Any of the equipment and instrumentation is usually less than $500 to a project and is easily available from many manufacturers. You need digital appropriate equipment that can be specified so that it's properly calibrated from project to project. The other thing on the commissioning side of it that I've talked about, again, although the standard talks about this 3-week window up to beneficial occupancy, we find that you really need 60 days. So projects that are 60 days or greater, you could have a formal commissioning process. 60 days or less, I call it the rapid startup. You'll do as many commissioning activities as you can, but you may be getting on what I call the train has left the station and your project's already been out there and you just want to test your water and you want to do a few things and find out where you're at in the process. That can be done through what I call rapid startup. So the parts of that under the construction budget would be the contract's labor and their participation on the WMC team, and how they're going to do hazard control, flushing, manual, automated. To the owner's budget, you have a separate budget with your contingencies and things. You may need a coach. You may need a consultant in this process to help train and teach people. You may need a consultant to create the project schedule and help people through this the first few times. I call it a pilot project for your organization. But your bigger part of the budget is probably going to be the analytical testing. That's write down the word sampling plan. You're going to have a validation sampling plan that can be guesstimated or estimated as a part of the project by looking at the size of the project, the number of floors, the floor configurations, the occupancy type, the number of fixtures, and the quantities of those in the buildings. Lots of fixtures, probably you're going to have more testing. And there's different types of testing that you can use in this process. So in construction, you might want to look at rapid methods of testing with deadlines versus traditional testing that can take longer in analytical laboratories to use. And then you're going to be able to roll over your program. So this is an investment you're making during construction, but not to be thrown away. You can use the same program to roll it over for ongoing operations. And all you have to do is adjust your controls. Your team that's then receiving that can have a handoff, and then you can use everything that you've developed for that building. So this concludes the formal portion of the continuing education. And I'm going to ask, we've put some links here if you want to go back to our own information at Phygenics, but I'm going to let Monica open it up and prompt me with some questions you may be sending in.
Great, thank you, Molly. And we have gotten several questions in, so I'm going to start with a couple bigger picture questions here. So the first one is, why aren't design professionals and general contractors more aware of these water safety aspects for our projects? So I think what we're getting at here is why aren't the design professionals doing more in this area?
Okay, so there's a few reasons. First of all, to their credit, no one's doing this intentionally. These are unintended consequences. And the design and construction professionals have been bombarded over water efficiency, and they are not chemists. Okay, they are not chemists. They're not microbiologists. They're not water management experts. They don't deal with what comes out of the pipe. Other than in the general sense, what has been historically done with coliforms and E. coli as fecal matter. And remember, ASHRAE 188, its audience is the building owner. Its audience is mentioned as the design professional and contractor. They are mentioned in there, but they are typically not the designee. The designee is someone who understands the operations and quality of that water. So we need them on these interdisciplinary teams, but they've been left out of the audience. And so contractors I've found that are specializing, if you have large construction companies that have multiple areas of their company, so today we're talking to academic institutions here, if you have contractors that have experience in healthcare, they maybe have run across some of these initiatives sooner in their practice than others who need, as this is sort of fanning out into other immunocompromised populations. And so we need to have more robust training in that. And it's really, the burden is a little bit on the building owner, that their master specs need to refer to ASHRAE 188. They're going to operate the building. And so there'll be more guidance documents coming out that are in the workings. I'm on some committees to do that for construction, to provide guidance to that industry. But that's partly why, is that the target initially from CDC has always been the building owner, and we need to get the design professionals involved.
Great, thank you. And since you mentioned ASHRAE 188 a couple times in your answer there, we did get a question about specifically ASHRAE 188. And so the question is, has the ANSI ASHRAE Standard 188 been widely adopted into building codes by states or municipalities?
The answer right now is no, but I would venture to tell you that in the next cycle of codes in 3 to 4 years, I think more of it will be. So for healthcare, the answer is yes. That's not our audience here today. But if you are an academic institution that has healthcare on its campus, or student infirmaries, or other exposures of healthcare and training, nursing, simulation centers, et cetera, you may find that exposure to the public is more regulated than you might think. So that's coming. And I think that with COVID-19, there was a huge emphasis that these buildings were shutting down, and bringing them out of dormancy was a problem. So more states went and grappling at what to do. And so there's a companion ASHRAE initiative standard 514 that is addressing a little bit more on construction. They are also emphasizing educational facilities as part of an expansion of the types of facilities that should be looking more at water quality due to the exposure of sensitive populations of young adults, children, or senior faculty, frankly.
Okay, great, thank you. There's a couple more tactical questions that came in. So the first one in that respect, it refers to validation testing when a building is unoccupied. So is validation testing necessary at every fixture in the building when it is unoccupied?
No. You don't have to necessarily test any fixture by law or even by the standard, but by the process, you must validate what you're doing, and that requires a test. If the building was occupied, as I said earlier, people use what's called clinical surveillance or population disease surveillance. When no one's in the building, you can't do that. So what we recommend is that you're going to develop a sampling plan that tests a representative sample of fixture locations. Now, how many is that? That can vary greatly. I put out rules of thumb here, but I'm telling you, these things all have to be looked at based on your individual program. I have found that I'm testing often on programs 15% of fixtures of specific types, both on the hot and cold side, of which you are going to look at a representative sample, and that can't be all in one location. Okay, so you have to have a representative sample by floor, by distribution, by distal location. You're probably always going to want to test your water main. You're probably always going to want to test the hot water loop system or the return. You might want to test after filtering, mechanisms or softeners that you have in certain parts of the building. So there are strategic locations. The situation you want to set up in your sampling plan, the reason you want to test robustly and representatively is you're looking for systematic impact, not just fixture impact. On ongoing water management programs, people focus on the fixture and its location. When we're doing things in construction, we're transferring our scientific finding, right, from one fixture to all the other fixtures in that area. So you have to pick a representative sample by which you are then going to translate your findings to look at systematic patterns that could be emerging in the building.
Great, thank you. There's also another pretty tactical question about flushing. So this question is, in your opinion, what is the critical time frame for flushing to displace 100% of the volume of water within a pipe?
Ooh, well, the way you can calculate that out, we just did that on a project. So we actually, our engineer of record and the contractor, the plumbing installing sub of record, gave us the volume of water, the capacity was. We divided that by a number of locations to turn the water system over on a weekly basis. And then we divide that by the amount of time or the amount of fixtures that we want a representative flush from. Sometimes it's all, sometimes we're setting up automated fixtures that can pull that water through. So it varies widely based on it. Some rules of thumb, we have found using flushing per days, multiple days a week. I like Mondays and Thursdays because it brackets the weekend of dormancy, at least 2 days a week to flush, but you really need to look at the minutes. The minimum would be 5 a fixture, hot and cold, and then you have to move to more robust time periods depending on the scale and how many fixtures you're talking about. But you can do a simple math equation to figure that out, and you can set up solenoid valves at some fixtures at distal locations to pull water through to cut down on the manual labor. That's a trick that several folks have been using.
Great, thank you. This next question I think is pretty appropriate for the audience for this webinar. So I'm gonna ask you this next one. So if there's a construction projects, a dorm construction projects, a dorm construction project and an academic building project, right, as an example, both are similar size, square footage, etc., but obviously have different end users and water uses. How different would the water management for construction be, or would it even be necessary to have one for a classroom building, right? So academic building versus dorm construction project, how different would a WMC be for those two building types?
Okay, well, this is where the safety risk assessment would come into play, and this would be up to your organization. Again, speaking in rules of thumb here. But if we just take the question and break it down. So dormitory has overnight stay, and it has showering activities. Those are aerosols that are going to be distributed. So that might be considered by that organization. They could say that was maybe more of a high-risk environment than the academic location where they have a sink and they're not doing with showering. They have, even though the age of the occupants maybe is the same, your activity in the dormitory with the showering is a higher risk fixture just in general than the academic location of the classroom. But you'd have to look at each, but as all things being equal, it would seem like the organization would find the dormitory or residential stay as higher risk on their safety risk assessment. And they could come up with a protocol that fits that. And then on their low risk for the academic building, they could say, well, we're going to do something, but it doesn't have to be as robust and as mitigation and controls as they would do on the academic. But that's up to the individual building, and you'd have to, look at fixtures and everything. But that's often how we divide that. And that's where having the safety risk assessment based on the risk attributes of the building occupants and the scale of the project can really help your organization have a policy that's uniform. So when each of these projects comes up, you're doing the same thing you would to be defensible. So you can say, well, all our academic buildings are handled this way, and all our dormitory buildings, for instance, are handled differently, but here's our reasons why. And by having that in the safety risk assessment, that's what helps you make that decision.
Great. Thank you. So this question, maybe we need to wrap up on this one. We'll see where we are time-wise. But the question is around state or local codes. So are there any state or local codes that require water management plans and or safety risk assessments for construction projects that last longer than 30 days?
In certain building types. So in our audience today, in education and academics, I do not know. The only one I'm thinking of could be the state of New York, but I'm not 100% sure of that. But your tighter states that typically have lots of policies can have those. I don't know of that in education per se, and you have to check with the local authority of what's been adopted. In healthcare, or if you have a healthcare occupancy, or you're being reimbursed by the government, or anything like that on your academic campus, yes, those are based on reimbursement, and there's a whole litany of obligations in building those facilities. So if you are around outpatient facilities, inpatient facilities, those things should be evaluated for sure if you have an academic medical part of your campus.
Okay, great. Thank you. Thank you for everybody that submitted questions today for Molly. And again, thank you for participating in this webinar. We're gonna wrap up the questions, and I am going to turn it back over to Billy to finish out the webinar.
Thank you, Monica. To Molly and Monica, thank you so much for taking time today to give us this powerful webinar. And to our attendees, as always, thank you so much for taking time out of your extremely busy schedule during these trying times to be with us today. So until next time, be safe, stay healthy, and have a wonderful day. Goodbye now.